Endometriosis is a chronic inflammatory condition that usually affects women of reproductive age because it's due to estrogen, and estrogen flares up the endometrial lining. Now, the endometrial lining is the lining that you find in the uterus. So endometriosis tissue is similar to that endometrial lining found outside of the uterus, and it can be found in the pelvis, and that's a more common area where it's found. It can be found in the ovaries, on the bowel, anywhere really. And so endometriosis causes a lot of symptoms, So firstly, I must add that it can be asymptomatic. So a lot of women can have it and actually not cause any symptoms. But a lot of women do get pain on menstruation. So they get painful periods. And the medical term is called dysmenorrhea. And that's because this endometrial-like tissue, when you have menses, you have this tissue in the internal cavity, and that causes bleeding internally, and the internal environment senses that as pain. So these women get period-like pain, and that's the most common symptom. But it can affect the bowels, it can affect the bladder, so it can cause bowel-related symptoms such as pain on passing stool on a period, or rectal pain. It can cause pain on passing urine on a period, and it can also affect some ligaments which get affected on intercourse. So a lot of women experience pain on intercourse, and the medical term is called dyspareunia. So that's what endometriosis is, and that's how it can cause symptoms as well. So the most common symptoms for endometriosis is usually gynecological symptoms, although it can affect the colorectal, the urological, and fertility, and also respiratory as well, and diaphragmatic. So first of all, I'll go through the gynecological symptoms. It can cause painful periods, pain on intercourse. It can cause, sometimes because of the symptoms are so severe in a lady's life, it can really impact their mental health. So it can cause them to feel really down, especially when they know they're going to have a period, and they might feel that they're letting others down as well, including their partner or their children, and it might affect or debilitate them so much that they can't, with a chronic pelvic pain that the painful periods lead up to, that they can't play with their children, and so they feel quite guilty about that. And it also affects wider aspects when they go to work as well. When they have painful periods at work, they feel they're letting other people down as well, their colleagues. Sometimes it can be so severe that they have to take time off work. And again, that might affect their mental health because they feel guilty regarding that as well. So it can cause a lot of physical symptoms, social symptoms, psychological symptoms. Sometimes they might also get infertility or fertility issues with the endometriosis, which can be improved in a lot of cases, but they might feel that they're not doing what they should be doing, which is childbearing as well, so that can have a mental health effect as well. In addition to all of that gynecological, then if it affects the bowels, they get bowel-related problems. They can go pain on passing stool, may change bowel habits, especially on the time of their periods. They might get obstructive symptoms as well, and then affects the kidneys or the urine. They might get recurrent urinary tract infections, or blood on passing urine, or pain on passing urine. And very rarely now we're getting more knowledge about endometriosis affecting the thorax or the diaphragm, and they might get on their period might get right upper quadrant pain as well. So that's not always the case, of diaphragmatic endometriosis, but it is. But we're becoming a bit more aware of that as well. The most likely theory is something called Müllerian metaplasia, which is a developmental problem in utero. And it might be combined with a genetic and an autoimmune element. So that's our current understanding of what might be the cause of endometriosis. Of course, we don't know. There's a lot of other popular theories like retrograde menstruation, but they've not proven to work for all cases as well. So they're theories at this moment in time. In terms of factors that can increase the likelihood of developing, there's none that are to my knowledge. However, it can run in families. So if your mother or your sister also have it, it may be that you've got slightly increased in likelihood of getting endometriosis. And there's not a great deal we can do at this moment in time to try and prevent it. However, if you are getting symptoms, getting treatment, recognizing it early and seeing professionals and getting treatment early can be a good thing. Sometimes being aware of maybe holistic changes or lifestyle changes, changing diet. Again, there's no high quality level of evidence that changing diet can improve things, but sometimes you may get concurrent irritable bowel syndrome, which might make the pelvic pain a lot worse, and hence you might wish to try a different diet. such as an anti-inflammatory diet or a gluten-free diet, and that might relieve some of the pain or bloating that a lot of women experience. However, as I said, there's no high quality evidence regarding that. The diagnosis for endometriosis would be really seeing specialists who can understand the condition and can early, on history, on talking to yourselves, might put it actually that all your symptoms are coming on their periods. And if they come on their periods, then it's very likely to be endometriosis. Although the textbooks say, you have to have a diagnostic laparoscopy to diagnose it. However, that'd be a lot of unnecessary surgeries, because a lot of patients with these cluster of symptoms that a specialist recognises can start medical management in terms of hormonal therapy. Because what we do know out of endometriosis is that it's to do with the estrogen, and these patients who've got endometriosis have times 1,000 estrogen receptors greater than other patients who don't have, or other people who don't have endometriosis. So it's heavily related to estrogen, which can flare up the endometriosis. And so what we do is we put them on hormones that they can tolerate, and if that reduces the symptoms, then it's very likely that they've got a diagnosis of endometriosis. In some other cluster of patients, we might get patients who have tried hormonal therapy, but it's not worked, it's failed, or they've got severe side effects. And they're not getting benefit. So in those patients, then we'd go for a diagnostic laparoscopy, a plus or minus treatment. So if we do find endometriosis, we can treat it as well by excisional surgery. And that's something that I do quite regularly and quite often. We go in there and we really do surgery and try and extract or excise all the endometriosis. So any pain to do with endometriosis should be removed. So the diagnosis for endometriosis on average is currently about 7 to 8 years, which is really hard to believe. And it can be that because sometimes, a lot of us health professionals don't listen to our patients, or, we give them a medication and we don't follow them up, to see whether the hormone actually works. And then those patients are lost to follow up. Certainly the referral process can take a while, but also the fact is that endometriosis might present to other healthcare professionals rather than a gynaecologist. So for example, I alluded to the fact that it can cause colorectal symptoms. So patients can get bloating on their periods, and they can get change in bowel habit, even rectal bleeding. So they might actually be referred to a gastroenterologist, who then does the investigation workup and then refers to a colorectal for a colonoscopy. That's all negative, and then they're thinking, and then they might come to a gynaecologist. So because of the difficult pathway, and again, you might have symptoms such as of urinary disease, so they might end up with a urologist. So because it is a complex condition as well, it could end up, in not the right hands, and then take a few years in that specialty and then be passed on. So it's really important that patients see a specialist who can recognise the condition and do the right investigation and treatments for this. So the treatment options currently available really consist of conservative measures, which lifestyle and pain relief, and then medical factors which are more hormonal, because we know that endometriosis is to do with estrogen. So we can use combined pill or a set of other medications called LARCs, or long-acting reversible contraceptives, and these all work to downplay or suppress the ovaries, so the ovaries produce less estrogen and flare up the endometriosis less. However, and it works in a lot of patients, I'd say it works in about 2/3 of patients, but there's a third of patients in whom it doesn't work, or it works for so long and then it no longer becomes effective. Or some patients just get a lot of side effects, they might get migraines with aura, or they might get extreme moodiness or irritability, or they might just get weight gain as well, or acne and other reasons, and so they might not wish to comply or take that medical management. And in those cases, then we go for surgical management again, which is either keyhole laparoscopy or robotic surgery, and excise the endometriosis. Now within there, and we kind of try and go along that lines, because we go from least harm to more risky, and surgery is more risky than taking a tablet. However, in a specialist's hands, it's quite safe as well, although there are risks. There's another cohort group of patients who've got fertility issues, and in those patients we'd probably go to surgery first and more soon, because obviously we can't give them contraceptive type medications to calm the condition down. My advice is, if the endometriosis is really affecting and causing a poor quality of life, then to see a specialist is a really good idea. So do your research and see who you wish you're more comfortable to see. And then think about diet, things that you can change yourself. So it might be diet, think about pain relief. And if you do get pain relief, think about trying to improve your pelvic core muscles. That can help in some places. However, I'm aware of the fact that the pain is so bad that actually you can't get on to do the pelvic core muscles either. So it might be that you need to seek this guidance of a consultant specialist in endometriosis and go the pathway, go together, get investigations, either take medication or surgery. And when you feel better, then you can go for the core muscles and physiotherapy and other adjunctive therapies.